Hello everyone, Dr. Triya here. Continuing with the pediatric neurology videos, we are going to learn absence seizures today. These seizures typically occur in children 4 years and above and who often have a family history of them. Typical absence seizures are associated with an interruption of normal brain activity, and due to a moderate impairment of consciousness, the patient is not able to see or hear. There is usually a blank facial expression. If you are new to my channel, please do subscribe and give like to this video. The hallmark of an absence seizure is the abrupt onset of behavioral arrest that occurs without warning, then equally suddenly and spontaneously ends with an immediate and complete return of alertness. Typical absence seizures do not cause loss of muscle tone, and thus they are not associated with falling, nor are they associated with incontinence of bowel and bladder. Rhythmic blinking of eyes is very common and may be the only motor manifestation of the attack, in often known as absence with eyelid myoclonia. To help make the diagnosis, hyperventilation may be attempted, which is more effective than photostimulation for inducing an absence seizure. The ictal EEG of an absence seizure is characterized by generalized and synchronous 3 per second spikes and wave discharge and is maximal over frontal midline. This pattern may start at a rate of around 4 per second and quickly slow down to 3 per second and eventually slowing down to 2.5 seconds in the final phase of the attack. Both beginning and termination is abrupt and may show normal EEG. These events typically last for 10 to 15 seconds. The most common medication used for absence seizures are ethosuximide, valproic acid and lamotrigine. A resolution of absence seizure usually occurs in younger adulthood. However, in some patients who may progress to the juvenile myoclonic epilepsy or another epilepsy syndrome. So that's all about today's video. I hope you all understood and learned well. Please let me know what other topics you would like to learn from me. Till that time, take care of yourself, study hard as well as study smart.